hopes she could reopen her restaurant doors this weekend.
I really don't know what to do anymore.
Crushed by the city's climbing rate of COVID-19 cases.
This has been really hard to take. I just don't know how much longer all of us can hang on.
For a month, gyms, bars, and dining rooms have been temporarily closed in the city to help slow the surge. That hasn't happened, and now they're not allowed to reopen for at least another 28 days.
And I am truly sorry for this. I really am. However, in my professional opinion, the greatest harm would be to allow COVID-19 to continue to spread at this rate.
Led by Toronto, the average weekly number of cases in Ontario is now double what it was at the height of the pandemic in the spring, about 1,000 a day, with a record 1,388 today.
These numbers are going in the wrong direction.
Despite that wrong direction, the Ford government isn't yet ready to talk lockdowns.
We want to keep the economy going, but we have to do it safely.
The Ontario government recently introduced a color-coded system to simplify closures. It spells out what can reopen and what can't. But the restrictions aren't enough for public health officials in Toronto and Peel region, so they've introduced their own measures. Question is, will it be enough?
No other jurisdiction in the world has been able to show that they're able to let the cases run rampant and both keep businesses open and save lives. So, the writing's sort of on the wall here.
Alita Solomon also sees the writing, a long winter where after nearly 20 years, her business may not survive.
And it breaks my heart because I don't know how to do anything else.
Vic Adopia, CBC News, Toronto.
Okay, now we asked infectious diseases specialist Dr. Lenora Saxinger to join us because Dr. Saxinger, in both Manitoba and Toronto, I'm sensing helplessness and urgency. Where exactly did things go wrong?
Well, I think in a lot of places across the country, we've seen just that too many people are in contact with too many people without enough precautions to prevent transmission. And that sounds very general. I think one other thing we see is that depending on the intensity of transmission, provinces are kind of making attempts to target what they're shutting down, if possible. But there's a lot of unknowns as to how much different areas are contributing to transmission sometimes, especially if we're challenged with the contact tracing. So, for example, restaurants are closed in some places, not in others. And I think that just reflects that unknown.
And yet, help me understand something. I mean, in Manitoba, where the situation is so dire, the code red doesn't even take effect until Thursday. Like, why wouldn't a person take that to mean, hey, I should see my friends one last time before we all get locked down?
You know, that's an interesting point, and I'm not sure about the rationale for the timing, but I definitely have seen implications from elsewhere that when there's a timed onset for a restriction, that there's a little bit of a last-minute rush to do things before a lockdown. I think that's a normal human response, but I'd have to say that in the setting of the types of transmission we're seeing in a lot of places, that could actually be pretty damaging if people take that approach.
Okay, Dr. Saxinger, thank you for making the time as always. Appreciate it.
Thank you.